Hi, I'm Dr. Betts with the Betts Clinic, and today I'm going to share with you who would be a good candidate for regenerative medicine. In our clinic, we have to do a very thorough evaluation and diagnostic testing to determine if someone is going to be a good candidate or not. There are a couple of factors that might eliminate somebody completely from having the procedure done. One of them is if they're suffering from a complete tear, for example, of like a rotator cuff that was a complete tear. There would be a gap in the tissue, and that gap, it just simply can't be bridged by regenerative medicine. Now that patient that has a complete tear of the rotator cuff, they may be suffering from some surrounding issues around that shoulder that could be helped with regenerative medicine. But the actual rotator cuff with the complete tear, it can't be repaired unless it's done surgically, if it is a full complete tear. Some of the patients that are wondering if they're a candidate or not, we're going to look at the amount of space that's left in their shoulder or their knee and look at that cartilage, see how much cartilage and other soft tissues are in the space. If there's a sufficient amount of space, then they're going to have better results than someone who is truly bone on bone. One of the biggest indicators to us is how the patient presents when they walk into our office. If they're still able to walk into the clinic unassisted, they're going to have a much better chance of having a good outcome than a patient who comes in a wheelchair, because their needs are just so bad that they can't walk. It's going to be a lot more severe. So don't wait until you're in a wheelchair before you come and see us. Don't wait until you're using a cane or a brace. Come see us sooner and you'll have much better results. That's what we see across the board. We can't tell if anyone is going to be a good candidate until we do a proper evaluation and examination, possibly take some x-rays and look at those, possibly even look at their MRIs. Let's say a patient sends us an MRI and they want us to look at it and tell them if they're a candidate or not. Well, we still have to evaluate and take a proper history and make sure that they're a good candidate before we can just tell them over the phone yes or no. We're not promising our patients that it's going to work for every single person out there, but we do know that if they're the right candidate, they're usually going to get great results. And overall, that's what we want. We want everyone to get great results and would love the opportunity to see if you're a good candidate for regenerative medicine. Thanks for watching.